Good afternoon, everybody. The chairman of PTF, honorable ministers, permanent secretaries, directors general, ladies and gentlemen. Building on the speech just given by the chairman, I will first of all start by saying that Nigeria currently has crossed the 1100 line and has a total of 11,166 confirmed COVID-19 cases in 35 states and the Federal Capital Territory, of which 3,329 have been treated successfully and discharged to their homes, while we have sadly recorded 315 fatalities. The daily epidemic curve of confirmed cases shows a consistently rising trajectory with corresponding increase in fatalities, but it's not comparable with what is observed in some foreign countries. But to rest on our oars for that reason will be a serious mistake. COVID is real, and we have explained that the increase in cases is due to improving testing capacity and also activities in other pillars such as surveillance, community mobilization, coordination, contact tracing, and also aspects of demographics and other not so very well known factors. The team from the Federal Ministry of Health that was deployed to Lagos and Ogun State, led by the Executive Director of National Primary Healthcare Development Agency, has returned. And I also want to use this opportunity to thank and appreciate the Nigeria Air Force. They have supported us in all our movements. At every instant, they have made transport available, and they have never said to us that they can't. I want to thank them in the name of all Nigerians. The team returned with optimism about having gained a better insight into the state-specific challenges and gaps where they visited. And they had audience with the executive governors, visited the state EOCs, and exchanged ideas with state health teams. A full report of findings will be ready next week, but preliminary findings are the same as we found everywhere, that the treatment of routine and essential cases has dipped a little somehow because of fear of COVID and also because of less patronage by persons who are afraid to go to hospital. But in the team were also a good number of people from Primary Healthcare Development Agency, Department of Family Health, Department of Hospital Services, NCDC, who were able to interact with all the counterparts in the states to develop a very good professional handshake. We are optimistic that the benefits are going to be seen very soon. The Federal Ministry of Health team to Kano, Sokoto, Jigawa, Borno, Katsina, and Gombe will be submitting their final report in a presentation to the Ministry of Health tomorrow. We shall share the results with you later. But the preliminary reports also show that the goals of the intervention were met. On Tuesday, the 2nd of June, I had the privilege of chairing a virtual meeting of ECOWAS COVID-19 Ministerial Coordinating Committee on Health, hosted by the West African Health Organization and attended by 15 ECOWAS Ministers of Health, and a few of them were represented. This is the first time West African Ministers of Health are meeting virtually. but they had met earlier in Bamako a few months back, and the Honorable Minister of State was at that meeting. This Committee on Health is one of 3 committees. The others are committees on finance and transport of the ECOWAS region, and they were set up to facilitate the work of the ECOWAS COVID-19 response champion in the person of His Excellency President Muhammadu Buhari, who was elected into this role on April 23rd, 2020, at a virtual meeting of ECOWAS heads of state and government. The attempt of West African leaders to address this common problem. At the meeting, we compared notes, discussed matters of regional cooperation and collaboration around COVID-19 strategy and response. We also discussed border-related challenges on movement of people and goods when borders are reopened. West African Health Organization and Nigeria are presently working together on a cost-sharing plan for a common air transport aircraft to convey COVID-19 supplies belonging to WAHOA to Nigeria from Beijing to Abuja. I also had the honor of presenting the statement of His Excellency President Buhari at a virtual global vaccine summit this afternoon, hosted by UK Prime Minister Mr. Boris Johnson. And the purpose was to mark 20 years since Gavi was founded. Gavi is a global alliance for vaccine and immunization. And the purpose of the meeting was also to raise funds to support the activities of providing vaccines to low-income countries. Just as we continue to engage states, we shall also continue to engage communities, religious and traditional leaders for sustained messaging to citizens. Also on the importance of adhering to health advisories to combat community spread of COVID-19. I again emphasize that much at this stage depends on a trust-based partnership between people and government to faithfully obey the rules on COVID-19 as laid down for our own common good. Support to our states will be tailored to the challenges and strengths of their health systems. The National Primary Healthcare Development Agency is discussing options and guidelines of supervised out-of-hospital isolation and care with some states, which is either home-based care or based in communal space, like school dormitories, since schools are presently closed down. As we continue to engage states on scaling up sample collection and testing capacity all over the country, we also continue to urge healthcare workers to ensure that they are protected with appropriate personal protective equipment and continue to exercise a high index of suspicion when treating patients. This is not the time to be careless. This is not a time to take risks. But it is also a time to listen to all patients, not to send people away. You can give them at least an advice. And if you are at a safe enough distance, you will generally also be safe. To comment on the various test kits that are thought to be in use in Nigeria, especially the antibody-based test kits, I would like to advise that only 4 of those kits have been evaluated by the Medical Laboratory Science Council of Nigeria, and all 4 of them failed the validation test. None of the antigen test kit has yet been evaluated. But what it means is that results obtained from these test kits, they're not tenable for diagnostics, and they're deficient in sensitivity and specificity, and are likely to give false results and mislead people. NCDC certified laboratory in Nigeria is still the WHO recognized PCR testing method which give us reliable results. Though expensive, this option is the right one. And right now we have over 30 laboratories in the network. And as you heard just now, one PCR machine just came in. And the aim is to establish at least one laboratory in every state, at least. So I would like to advise again all citizens to please put on your mask for your own safety and your own protection, and for the protection of others. This is one of the few easy steps that we can take to protect ourselves, particularly when we're in a crowded environment. We know that physical distancing is not always feasible, it's not always realistic to be expected. Therefore, it is a barrier of this nature as a minimum protection, but not the only protection, not the sole protection. We still encourage distancing as much as possible, the use of sanitizers, hand washing, open your window for fresh air wherever it's safe for you to do so. And also wear your mask even inside your house if you are not sure of the COVID-19 status of people you are living with in a locked environment. And remember the respiratory hygiene, the use not to cough into the open space, but to use tissue or a handkerchief. Thank you very much for your attention.